Here at Equivision, we spend a lot of time concentrating on intestinal digestive health in the horse. And we were really the first ones to put together a program that will actually address health and function of the hindgut of the horse, the small intestine as well as the large intestine. It's well accepted now that many horses present with intestinal inflammation or hindgut inflammation. I consider the hindgut of the horse to actually be susceptible to 3 different stages of intestinal health. Stage 1 would be normal health, where the horse is perfectly healthy and there are no concerns in terms of feeding or the overall health. Stage 2 would actually be what I refer to as a stale gut. And when a stale gut, fermentation in the horse's large intestine becomes a little bit unbalanced, the rate of fermentation slows down, and that is what sets the horse up to develop into intestinal inflammation. When we have a stale gut, or when fermentation rate slows down, one of the first things you'll notice is a horse tends to reduce his appetite. He may reduce his water intake. The horse might become a little bit more finicky in what the horse will or will not eat, which is one of the key things that we look for when we try to determine if a horse is suffering or presenting with hindgut intestinal inflammation. The third stage would actually be inflammation of the intestine, where we begin to get very slight thickening of the mucosa. We begin to get irritation of the small intestine and or the large intestine. And then the fourth stage would be enteritis or colitis, which is a medical condition that definitely needs intervention from a veterinarian. Now, how do you know if your horse is even presenting with a stale gut or the very beginning stages of intestinal inflammation? Unlike gastric ulcers, we really cannot put a scope into the horse and actually look at the intestine. By the time we can use ultrasound and actually measure thickening of the intestinal mucosa, if we're able to measure thickening of the mucosa, we are already well along the way of developing into serious inflammation, borderline into enteritis or colitis. We want to identify these horses before they ever get to that point. The best way we do that is really by looking at changes in behavior and very specific changes. For example, a very common one is my horse's attitude changes. They don't want to be compliant as they used to be under saddle. They tend to get a little touchy when you're working on grooming them in the flank area. They tend to get girthy when you're trying to put the saddle on. They show symptoms that they might be tight or sore in the back or tight or sore in the hamstrings. All of these things are consistent with intestinal inflammation. There are actually some acupressure points in the horse that are connected with intestinal function. For example, the entire wither pocket is an acupressure point for the digestive tract, which is one reason why when you tighten up the girth on a horse with intestinal inflammation, he reacts. He's reacting to that pressure on the withers. It's very common also under saddle for these horses that used to bend freely both directions, right and left. Now you find that they bend better one way versus the other. They get a little resistant to forward pressure. They might get a little resistant to flying lead changes. They're not as supple as they used to be. They're not as relaxed as they used to be, which is another symptom that we look for, is these horses start to become a little bit more hyperreactive. And so many times people are thinking that they want a calming product, when in fact the real problem is that the horse's intestine is simply inflamed. So how do we address horses with hindgut inflammation? There are 3 things that we try to correct. As we mentioned, one of the first things that happens is fermentation in the hindgut slows down or becomes unbalanced. So objective number 1 is to correct fermentation. So we do that with very potent and powerful probiotics. These are probiotics that are actually going to make their way into the large intestine of the horse, promote the growth and proliferation of other bacteria that we want in the hindgut of the horse. So probiotics promoting fermentation, objective number one. Number two, anytime you've got any type of inflammation in the small intestine and large intestine, immune function is going to be adversely affected. 70% of your horse's immune system is found in the digestive tract. So we're going to use some prebiotics and some other components in these diets in our 21-day hindgut health program that are going to stimulate normal immune response by the horse's intestine. And then three, if we have intestinal inflammation, we want to supply something that's going to be anti-inflammatory for the intestine. And what we use in this case is the omega-3 fatty acid EPA, which is only found in fish oil. So in our program, you will find a product called the fish oil factor, which is the product that supplies that EPA, which is anti-inflammatory for intestinal tissue. And if your horse does in fact have hindgut inflammation, and you put your horse on our 21-day hindgut health program, at the end of those 21 days, you will see a definite benefit and you'll have a different horse at the end of that program.